This is a case of NKT cell lymphoma. These are cases that are managed with a definitive dose of radiation, a higher dose. And the whole concept of ISRT is completely different. While we are interested in avoiding the critical structures, the priority is really to target the area of disease. This is a 61-year-old male who presents with a stage 2 NKT cell lymphoma. Here we enumerated all the areas that are being involved, but as you can see, this is an extensive involvement that goes into the neighboring structures. Definitive radiation therapy has been decided to go concurrently with chemotherapy. We show here in the axial images how we fused with the MRI and also with the PET scan. And we also use the CT scan that was done for simulation. The reason you need all of these three modalities is each one of them would give you information about bone, soft tissue, or the activity of the cancer. If you take an example in this area where you're contouring the CTV, and you look at the corresponding one from the PET scan, if you were using only the PET scan, you wouldn't have included this part, while if you're looking at the MRI, you would. Therefore, it is advisable whenever you're contouring your CTV to fuse with all available modalities prior to starting the treatment. This is another set of images displaying the disease below the eyes, where you can again see how the MRI would give you excellent information about where the disease extension is. You sometimes include areas that might have been just an inflammation, but then for the sake of being safe and being comprehensive in this disease, we actually include even the areas where we think that might represent a possible inflammation. This is a coronal image to show you how we contoured the case in relation to the eyes as well as to the brain. We quite often have to have a very frank discussion with the patient from the get-go that the treatment that we give might affect, for example, in this case, the visual field in the inner part of the orbit, or it might affect their ability to have a normal salivary function in the future. But as I said, this is a completely different disease where the radiation dose and field are very important to ensure local control and disease-free progression. When using the IMRT, we have to encompass the PTV with a good dose, more than 95%. You can see here that this area of the eye still got a higher dose. You can see that part of the oral cavity also got a higher dose. These are the discussions that we are going to have with the patient. Sometimes we also suggest to them that we're gonna put an NG tube to ensure that over the 6 weeks treatment that this treatment would span, they would be well nourished and they would not lose weight. Although we are trying to minimize the dose to the brain, but then sometimes we end up treating a good portion of the brain, as you can see with the dose. This is a sagittal and a coronal view just to see how comprehensive our fields are in this particular disease. Obviously, we have to keep an eye on the critical structures, and every effort has to be made during the IMRT planning to keep as much as we can the critical organs safe. It's showing here that the left cochlea has a mean dose of 38 and a max of 47.9, which is higher than what we have expected or wanted in this particular disease. Same thing with the left orbit. There is a maximum dose of 48 centigrade. Again, there is part of the left orbit that probably will cause trouble in the future, but then controlling the disease obviously is a priority. The take-home messages is that NKT cell lymphoma is a very aggressive disease as opposed to other subtypes of lymphoma. The target should include any clinically or radiologically suspicious site. Covering the target takes priority over respecting the critical organ's tolerance. However, discussions with the patient are required during the consent process. Radiation therapy course can be challenging for patients. However, treatment breaks are highly discouraged as this can negatively impact disease control and outcome. In cases of severe mucositis, develops a PEG tube should be considered to maintain adequate nutritional status. For patients who presents with large tumors comprising critical organs, if disease response occurs during the treatment, adaptive planning can be considered to reduce doses to organs at risk.